Welcome to Diagnostic Imaging. I'm Whitney Palmer, Senior Editor. For more than 2 months, radiology as a whole has been impacted in a variety of ways by the COVID-19 pandemic. It is an outbreak that has touched every hospital department, every practice, and every imaging center. But it's safe to say that not every radiologist has experienced this situation in the same way. We are joined today by Dr. Geraldine McGinty, President of the American College of Radiology, to discuss how this pandemic has affected female radiologists differently than their male counterparts. What challenges have they faced, and how have they been impacted by those challenges? In what ways are female radiologists perhaps uniquely suited to assume greater leadership roles during this time? And what lessons can the industry learn from this experience about gender equality in the specialty? Thank you for joining us today, Dr. McGinty. We're delighted to have the opportunity to talk with you.
Thank you for having me, Whitney.
Wonderful. Well, if you could, walk us through the professional challenges that female radiologists have faced during the pandemic.
Honestly, I think those professional challenges really cross all genders. Figuring out how to manage working from home, possibly for the first time, figuring out the challenges of childcare, and if you have an administrative role, navigating all of those Zoom calls. And then also, trying to maintain, especially if you have an academic career, trying to maintain all of that other work that was fitted around your clinical practice.
All right. So then specifically, I guess, let us know the impact that those challenges have had and how they have touched on the female radiologist ability to practice at a high level right now.
Well, I do want to first of all acknowledge that there are definitely radiologists who are at the front lines. I've been so humbled to see actually in many cases our trainees being redeployed and pulling out their clinical skills to deliver care in the ICU. So let's just be clear that radiologists have been contributing in many ways, but let's talk about the more routine clinical practice. And I think that first of all, as I say, getting set up from home and trying just to navigate the demands of the day between figuring out homeschooling and if you have a significant other at home who's also trying to work from home. But I think there's definitely data. Let's focus on some of the areas where we have data where there may be a real impact. And I think one of the things we are seeing, and you may have noticed the Nature article that talks about the fact that women are uploading fewer articles to preprint servers. And there's a sense that their research is taking a second place to all of the other things that they're trying to get done. So that's one thing I think we're going to want to be really aware of. I know my own institution has sort of stopped the tenure clock for some time, and I'd like to make sure that we're not going to disadvantage women as we come out of this pandemic because of perhaps having had to put other responsibilities first.
All right. Well, you mentioned some of the literature. There was also a study that came out looking at the differences in how female and male radiologists are handling video conferencing. What are some of the issues that have kind of bubbled up in looking at that particular situation?
I've read a lot of that research too, and there's no doubt that we women are sometimes harder on ourselves. We're worried about how perhaps we look on the video conferencing, and you can see that I have a virtual background, so that just make sure I don't have to think about what's behind me. But I think at this point we've all adapted. I think having your kid or your pet to join your video call is pretty much normal now. I will say in my own department, we've been doing twice a week video calls with our chair. And, the goal has been for everyone to have a chance to talk about what this means to them, talk about how they're coping. And I think it's really important that we acknowledge that this is not perfect, this is not normal, and we have to cut ourselves some slack and be kind to each other.
All right. Well, we've talked a great deal about the professional challenges. What about some of the personal ones? You touched on it with childcare and significant others and parents. How are women necessarily feeling this differently than male counterparts?
I don't know that I can really speak to that in a particularly informed way. There's certainly been, you've seen news articles out there about how male parents think that they're doing great with helping with the education. Their female partners don't necessarily agree. I'm not a mom, so I'm not going to weigh in on that. But what I will say is that I've seen a huge amount of connection and solidarity among our entire radiology community, but certainly a lot of programming from our Radiology Leadership Institute, from the AAWR, to help us support each other through this time, help us make sure that we protect time to exercise, time for self-care.
All right. Well, then going down that road just a little bit more, talking about strategies and actions that maybe we can implement to help each other during this time. What are some of those things that the industry as a whole perhaps can do to help both female and male radiologists at this time kind of rise to the top of their abilities?
Well, I think it really does start at the top. It starts at the organizational level. And I think that for an organization like the ACR to really commit to wellness as a key strategic initiative and make sure that we have programming and tools out there, that's really important, because that says that as a community, we've decided this is worth our investment of our time and resources. And then I think it becomes, if we take it all the way to the individual level, it's about checking in on each other and just a quick note that says, how are you doing? Is there anything I can help you with? But also, for some of us who aren't necessarily as burdened as others with things like childcare, it's about taking the opportunity to reach out to, say, a med student who's interested in radiology, who's been furloughed or sent home, to say, is there a project you'd like to help me with? So that we can actually keep connections going, build connections, and not lose so much momentum during this time.
All right. So even though there are a myriad of challenges, and you started to touch on this, are there ways in which female radiologists can take this opportunity to assume greater leadership roles within their own institutions or exert more influence?
I think that in my ACR report to the council, I talked about, I was very impacted by an interview that I read with Rabbi Jonathan Sachs. And he said that each of us has to say to ourselves, what does this crisis ask of me? And I think that, really thinking about how we can contribute, and whether that's being on the front lines in the ICU, doing things that you're not necessarily comfortable with, whether it's checking in with colleagues, whether it's finding the time to actually write about the experience. Our impact can be very, very varied, but I think each of us has to think about what we can do. Now, that said, I think you have to be very aware that, with working remotely, this Zoom call format that's not perfect, this can really impact imposter syndrome, and it can actually, I think, compound that and make it feel worse. I'm not in the department. I'm not being seen at meetings. I'm struggling to manage all my responsibilities. So again, I think as a community, we have to be caring. We have to, realize that I hope this is temporary. That this is not normal, and not worry too much if, we haven't, made a major contribution as we see it in the short term.
All right. Well, then looking into the post-COVID environment, then what are some of the lessons that this experience has taught the industry about, making sure that there is that equal opportunity and chance for female radiologists to, again, contribute to the highest level?
I think many practices made a significant shift to home reading much more quickly than they thought that they ever could, and much more comprehensively than they thought they ever could. Now, I think a lot of us miss the interaction. I've still been doing some clinical work, and I absolutely love my day on campus. So I think, but I think realizing that we can be much more individual in terms of how do you like to work? How can we accommodate your life and make sure that you're, successful radiologist at the same time. So I think finding that ability to be more nuanced as opposed to a one size fits all is something that we've all learned.
All right. Well, I appreciate this. Kind of stepping back to that 50,000 foot level, thinking from an anecdotal perspective or a data driven perspective, is there anything else that the community needs to know about how this pandemic is affecting radiologists in different ways that we should really point out?
Yeah, I think that there are some clear challenges for our radiology community. Having made the very appropriate decision to pull back on non-essential imaging, we're going to see practices really struggling financially, especially those practices in small and rural areas who are not only significant caregivers in their communities, but also significant employers. So, this is going to be a challenge. And I think we all worry at this point about delaying, life-saving screening exams much longer. So I think we're all struggling to think about how we can get back to normal as quickly as possible, but as safely as possible. So I'm very proud of the guidance that the ACR has provided there. But I think to recognize the value of imaging, it's important that we recognize that the imaging that we were doing was valuable and will remain valuable. So we have to make sure that we preserve that access for our patients.
All right. Well, Dr. McGinty, thank you so much for taking the time to talk with us today. I greatly appreciate it.
Thank you very much for having me.